Good day, I am Monica Baluyot from BSN 3C, and today I will perform the procedure and indicate the rationale of assessing the physical changes on older adults. There are some equipments on assessing the physical changes on older adults. We have the newspaper or book, glass of water for swallowing test, chair for get up and go, face mask, BP apparatus, food items such as citrus fruits for the sense of smell test, pillows for the patient's comfort, clean gloves, and pen light. Here are some procedures of assessing the physical changes in older adults. Number 1. Prior to performing the procedure, introduce the self and verify the client's identity using the agency protocol, so the patient will know the nurse's identity and vice versa. Explain to the client what you're going to do, why it is necessary, and how we can participate so they can cooperate during the procedure. Discuss how the results will be used in planning further care or treatments, so they will have knowledge about the benefits of the treatment and about their situation. Number 2. Perform hand hygiene, apply gloves, and observe other appropriate infection prevention procedures. This is to prevent contamination to the patient. Number 3. Provide for client privacy. Request the presence of another healthcare provider if desired, required by agency policy or requested by the client. It prevents awkwardness and uncomfortability to the patient. Number 4. Measure and record the client's height and weight, noting the weight changes, changes in appetite, nausea and vomiting, and problems with swallowing or chewing, and evaluate hydration status as you would nutritional status, so the nurse will know the history of the patient. Hi ma'am, I am Monica, your nurse for today. Today I will perform a physical assessment on older adults. But before ma'am, can I know your name?
I'm Miss Ira Villanueva.
Okay, Miss Ira. I want you to cooperate with me during our procedure. So now let's proceed on assessing the skin. Inspect and palpate the skin lesions. Wear gloves with palpating lesions. Then note whether lesions are flat or raised, palpable or non-palpable, and also note the color, size, and exudates if any. Note the color, texture, integrity, and moisture of skin and sensitivity to heat or cold. This is to determine if there are any presence of nodules, discoloration, etc. Okay, now ma'am, I will assess your skin. I will palpate your arms. So now let's assess the mouth and throat. We should inspect the gums and buccal mucosa for color and consistency. Observe the client for swallowing foods or fluids. And lastly, test the gag reflex. This is to determine if there are any risk of developing other oral problems or abnormalities. Okay ma'am, now I will assess your mouth and throat. Can you please open your mouth? Okay ma'am. So now, let's go and test the nose and sinuses. We should inspect the nose for color and consistency. Then evaluate the sense of smell. Have the client close the eyes and smell a common substance such as mint, lemon, or soap. Then Test nasal patency and ask the client to breathe while blocking one nostril at a time. Then palpate the frontal and maxillary cyanosis for consistency and to elicit possible pain or no more lesions or pain. This is to determine or assess the function of the airway and to determine if there are any presence of cyanosis, infections, or abnormalities.
So now, ma'am, I will assess your nose and sinuses. I want you to close your eyes and smell this thing. Can you please identify what is it?
So,
So now, ma'am, I want you to cover your left nostril. Then breathe. How about your right nostril? I will assess and palpate your frontal and maxillary cyanosis.
So now, let's test the eyes and vision. We should inspect the eyes, eyelids, eyelashes, and conjunctiva, and also observe eye and conjunctiva for dryness, redness, tearing, or increasing sensitivity to light and wind. We should also inspect the pupils with a pen light or similar devices, test pupillary reaction to light, and lastly, test the vision. Ask the client to read from a newspaper or magazine. This is to detect the eye problems, especially at their age.
So now, ma'am, I will assess your eyes and vision. Can you please look at me, ma'am? So now, ma'am, I will give you a newspaper. I want you to read it loud.
isang dalaga ang nakitang sugatan sa daan.
Thank you, ma'am.
So now, let's test the ears and hearing. By assessing the ears and hearing, we should inspect the external ear and observe shape, color, and hair growth, and also look for any lesions or drainage. We should also perform the voice whisper test. This is a functional examination to detect obvious conversational hearing loss. Stand approximately 2 feet away from the client and whisper a sentence. This is to determine or find the cause of any symptoms of earache and also to determine if there are any hear loss due to excess was.
So now, I will assess your ears and hearing. I will inspect your ears. I want you to turn your back on me.
Ma'am Ira, you are beautiful.
You are beautiful.
So now, let's test for thorax and lungs. In assessing the thorax and lungs, we should inspect the shape of the thorax, note the respiratory rate, rhythm, and quality of breathing. Auscultate the lung sounds as you would in a younger adult. This is to determine if there are any abnormalities can be detected, like difficulty in breathing.
I want you to turn your back on me again. Ma'am, take a deep breath. Inhale, exhale. Inhale, exhale. Inhale, exhale. Inhale, exhale. Okay.
So now, let's assess the heart and blood vessels. By assessing the heart and blood vessels, we should measure the blood pressure, inspect and palpate the precordium, and auscultate heart sounds. This is to monitor the vital signs, especially the blood pressure.
Now, ma'am, I will measure your blood pressure. I want you to sit properly and put your left arm here. Ma'am, I will palpate your precordium and auscultate your heart sound. Okay, ma'am.
So now, let's assess the breast. By assessing the breast, we should inspect and palpate the breast and axillae. This is to determine if there are any presence of nodules, lymph nodes, cysts that indicates of pain.
Ma'am, let's assess your breast. I want you to raise your left arm, then using your two finger, assess and palpate your breast. Start from under your armpit, around your breast.
So now let's assess the abdomen. By assessing the abdomen, we should assess the gastrointestinal motility or GI motility and auscultate the bowel sounds. Review for fiber intake and laxative use. Inspect and percuss the abdomen in the same manner as for younger adults. And palpate the bladder. We should also ask the client to empty the bladder before the examination. This is to determine the patient abdominal and bowel problems.
Before I will start the assessment regarding to your abdomen, I want you to go to the comfort room and empty your bladder before I will proceed to the examination. So ma'am, I want you to lay your back in the bed and I will assess your abdomen. Ma'am, I will palpate your abdomen. Now ma'am, I will auscultate your abdomen to hear or inspect any kind or any signs of abnormalities.
So now let's assess the genitalia. We have the female and the male genitalia. In female genitalia, we should inspect external genitalia and assist the client in the lithotomy position. This is to make the examination easier because it widens out the area of the genitalia. We should also inspect the urethral meatus and vaginal opening. This is to determine if there are any presence of lesion.
I want you to lay your back in the bed and flex your knees. So for the privacy, I will cover you with a white towel. Then ma'am, I want you to cough. Okay, ma'am. Imagine that Ma'am Ira is a male patient. Sir, can you please stand up? Then, I will inspect your male genitalia. I want you to stand up. Then please walk back and forth. I want you to raise your arms a little bit and I will palpate it. I want you to show me your wrist and I will palpate it. Now I want you to flex your arms. Then rotate it. Ma'am, I will palpate your knees, joints, and ankles. Then I want you to flex your knee. I want you to stand up and show me your hands. And I will pinch it. Do you feel any pain? Mom, for the last assessment, I want you to follow what am I doing. Put your hand here. To raise your right leg. How about mom, your left leg? Okay. Thank you. Ma'am Ira, now let's proceed to documentation. I will tell you the results from the physical assessment that I performed on you. So regarding on your skin, from the assessment of your skin, you do not have any sign of jaundice, cyanosis, or any abnormalities. While on your mouth and throat, as what I expected, you have healthy gums and teeth, and there is no any signs of abnormalities. While for the nose and sinuses, as I palpate your nose, there is no lesions or lumps. For the eyes and vision, as I observe, your reaction to light is normal, which your pupils dilate when there is no light and constrict when there is light. Also, you have a good eyesight and eye vision. And so as what I expected, your ear canal, there is no lesions and you have a good hearing. From the thorax and lungs, as I heard, you do not have any abnormalities in sounds, which is wheezing, squishing, or any signs of abnormalities. In your heart and blood pressure, as I measure your blood pressure, your BP is 120/80, which is normal at your age. Also, as I palpate your precordium and auscultate your heart sounds, there is no abnormalities. And last is also for your breast. There is no signs of any bulks or lumps. Ma'am, in your abdomen and genitalia, as I inspect your abdomen and genitalia, I did not see any signs of abnormalities. While in your musculoskeletal and neurological system, as what I perform in you, from your overall performance, as what I assess, everything is normal. Thank you, Ma'am.